Hi leaders, my name is Mary Jo Quinn and I'm in the postgraduate DNP program. I want to talk about how a nurse leader addresses medical errors while still fostering creativity among nurses. I've selected an article written by Sandra Warner called Productive Errors: Transforming Learning Experiences in Healthcare. I'd like to apply the principles presented in the article to a common scenario that I've created for the purpose of this review. From this information, we can determine that a medication error has occurred. So here's the question: how does a nurse leader effectively deal with this situation to prevent future errors like this? So what do you think? Well, the answer is we really don't know yet. Each of these is an effective strategy depending on the factors involved in the area, so we'll come back to this question later. This article emphasizes the importance of establishing a foundation where medical errors can be viewed as opportunities for innovation and creativity. The author describes traditional leaders as frowning on any behavior that places the organization at risk. The mindset of this type of leadership is mistakes cost lives, and nurses should never guess or experiment with unfamiliar procedures. But in today's fast-paced healthcare, the need for thinking outside of the box is emerging. Transformational leadership is the perfect fit to meet these needs. Let me stop here to clarify that in our quest for creativity, we should never knowingly put a patient in harm's way or violate accepted practice standards. Okay, let's go back to transformational leadership and creativity. In an effort to reduce risk to the system as a whole while helping the individual and team recover from the error, the article discusses the need for a transformational leader to create a just culture. This concept has been prominent in some of the transportation industries for many years, but is a relatively new concept in healthcare. Essentially, it is a shift from blaming and punishing those who make errors to promoting system improvements to prevent future errors. It is important that the leader creates and maintains a culture where staff feels safe reporting mistakes. Without this transparency, issues aren't identified, and then they can't be fixed. The leader's response to a medical error is crucial in a just culture and should avoid reactive punishment and blame. Although coaching may be necessary, nurses should still feel supported. The leader may need to help the employee deal with a sense of failure and remorse from committing the error. But just as important as the leader's attention to the individual is the leader's focus on identifying process flaws. A just culture creates opportunities for bedside clinicians to research best practice and redesign care to prevent similar errors in the future. In short, a just culture emphasizes values, instills trust, and motivates others to strive for excellence. I want to clarify that the transformational leader is intolerant of risky or reckless behaviors and views these as very different than medical mistakes. These can be differentiated by the nurse's intent. Risky and reckless behaviors are considered choices not to conform to accepted practice standards, such as nursing regulations or safety protocols. One example of this type of behavior is the nurse who diverts medications. This action is a conscious disregard for the well-being of patients. Mistakes made in these situations generally aren't considered to be productive. In this example, the nurse made a choice not to adhere to practice standards, yet there was a systems component that impacted the nurse's ability to function normally. Now let's go back to the vancomycin scenario. It's obvious that an error occurred, I think we can all agree on that, but we're not sure whether it was a medication error or a documentation omission. So the first course of action is to figure this out and take care of the patient, right? Let's look at each of the choices for the nurse leader to effectively deal with this situation to prevent similar errors in the future. First choice is A. Well, first the leader needs to determine the underlying cause for the error. Was it the nurse's total disregard for the process? Probably not, but this needs to be considered. Were there process issues that interfered in the delivery of care? Well, whatever the reason, nonetheless, I think it's fair to say that some type of verbal coaching is warranted and should be guided by the factors which we discussed earlier. Now looking at B, providing mandatory education to all nurses on the unit is probably a bit overzealous. This may be appropriate at a later date if an elaborate process change is implemented as a result of the error. C, permits the unit's team dynamics to manage the identified risky behaviors. Well, according to this article, this is an appropriate strategy in general, but can be considered more of a preventative method. For a past error, it should be used in conjunction with other strategies. And finally, D. There are a lot of questions that need to be considered for this option. For instance, is this a high-risk, high-volume procedure? Do other nurses commonly make this error? Does the problem reflect an organizational initiative? There are many more variables to be looked at. If this is an isolated occurrence, establishing a QI team is probably unnecessary. One right answer to this scenario, regardless of the underlying reason, and that is for the transformational leader to sustain and nurture a just culture in the healthcare setting. This helps the team feel comfortable reporting the mistake and also promotes team problem solving of the system's issues that were factors in the cause of the error. Now, it may not seem that this article addressed the concept of creativity, but its premise is that a nurse leader must cultivate an environment, that is a just culture, where nurses are empowered to be creative. This model for creativity is associated with improved engagement, greater job satisfaction, and decreased conflict among nurses.